We have certain populations of patients that are appropriate for this type of center. First off, there are patients that leave the allied services inpatient settings, whether they're in the rehab hospital, whether they're in the transitional rehab program. They go home and we want to see them back in a couple weeks to make sure that that transition to home worked well. The last thing we would want to do is see that patient end up back in the hospital having difficulty with the services that we set up for them, whether it was home health, outpatient, and they're just not getting what they needed to be getting. The second population are patients who've already been through their course of outpatient therapy, they've been through an inpatient stay, they're home, it's now 3 months later, maybe they're not doing as well as they had hoped to, and they want to get a reassessment to see, should I still be getting something else in order to improve my function? The third group of people are people who have recently had a hospitalization stay and they were sent home. And they're just not doing as well as everybody thought they would by just going home. And they may need some other type of rehabilitation to get them going rather than just the services that are available at home. Those are the types of things that at the Rehabilitation Medicine Center we'd be able to assess and determine whether or not you would require something different than was set up for you if you were recently at a hospital. And then there's a group of people who didn't need to be hospitalized, but they're just not doing well at home. They're having more difficulty walking, they're having more difficulty taking care of their activities of daily living, such as just transferring, getting up and out of bed or out of a chair or dressing themselves. The Rehabilitation Medicine Center, again, is a place that the focus is on function, where they could be evaluated and determine what would be the best form of rehabilitation in order to help them.